Hello everyone. Hello everyone, and welcome to this audio podcast. As part of the Haemotoxy. This audio podcast as part of the Bostics and Baraga and the specials. This audio podcast as part of the Express and Caliber, and this audio podcast as part of a Storm Lobostics production. So, in on this audio podcast, I look at some intro in as part of works by a science student within an academic institution in the UK, and where the science student Hussain looks at hematoxylin and eosin and quinine carbofusion staining for the diagnosis in a patient case of tuberculosis. So a little bit of intro in as part of some elements of or basis of histopathology. So in histopathology, it is the investigation or the basis of where healthcare professionals within laboratory environs and laboratory environs look to determine or inform the diagnoses of disease within cells and tissues. Now, before going into a bit more of this intro, just to inform that histopathology has a close link or interlink with the basis of cytology, which is primarily or specifically the study of cells. But histopathology is the study or the investigation of tissues and cells. So tissues and cells under laboratory environs. So additionally, it is where the investigations are the investigation of tissues or within tissues and cells are under microscopic examination or investigations. Pathologists and also sort of clinical scientists and biomedical scientists within laboratory environs look to investigate and interpret histological or histopathological findings, and these are defined as sort of the characteristic basis of tissue and cell anatomy, and sort of determining the normal from abnormal in context of the anatomical changes that cells and tissues undergo during and as part of disease or condition onset. And additionally, histopathological methodologies are coupled with a patient's clinical history or medical history, for example, can be or are paramount or pertinent in allowing laboratory investigators to pass on the particular and specific details to frontline healthcare professionals to ensure that such can correctly diagnose patient cases, and to additionally help determine the sort of treatments treatments, and sort of the sort of aspects of aspects or elements of particular conditions in context of ensuring that patients or healthcare service users, for example, have the applicable sort of aspects of pharmacotherapy or treatments, as said, but also um, in a context of ensuring patients, healthcare service users have a basis in on prognoses. So that draws this initial audio podcast, this intro audio podcast, to a close. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga and the specials. This audio podcast is part of the Express and Clever, and this audio podcast as part of a Storm Robotics production.